DNA repair mutations have been observed in patients with castration-resistant prostate cancer in a study, or at least a summary of different studies from 7 institutions. It seems to be expressed in about 12% of patients. So olaparib has been studied in the PARP trial in patients with castration-resistant prostate cancer, both who have no DNA repair mutations, as well as those patients who have those DNA repair mutations. And there's a much higher rate of response in those patients who have DNA mutations. It's 14 of 16 patients, where only 2 patients responded who did not have DNA repair mutations. So this may be a key in helping us to layer our therapy for prostate cancer. There are several phase 3 trials that are now being performed in castrate-resistant prostate cancer with PARP inhibitors. There are 5 different inhibitors that are now being evaluated, and these include olaparib as well as rucaparib and volaparib as well. So there are a number of drugs that are being looked at in this situation. Now, I mentioned before that the number of patients who have BRCA, about 12% overall. And the question is, how can we further generalize this technique of using DNA repair mutations to cause cancer cell death? Well, there are agents that can actually cause BRCAness, and these are agents that induce hypoxia, as well as the next generation anti-androgen agents. So at Yale, we are going forth with, we are leading a trial, At Yale, my junior attending, Joseph Kim, is leading a trial of olaparib combined with cediranib to exploit this issue of hypoxia-inducing BRCAness. And it's a randomized phase 2 trial. If you randomize to olaparib alone and you progress, you are eligible to receive cediranib. So hopefully we'll see that BRCAness is induced in these patients. We are doing also molecular correlates with this particular trial. Other investigators have chosen the route of next generation anti-androgens. And we know from preclinical data that abiraterone will increase or decrease DNA repair enzymes. So there are studies that are being performed with volaparib that was done at the NCI, did not meet its primary endpoint. Olaparib combined with abiraterone compared to abiraterone alone has a superior progression-free survival in a trial that was recently presented at ASCO. And this is going to be expanded to a phase 3 study, which will test this particular hypothesis. It's possible, and I think from some of the molecular marker data, we see that patients who do not have DNA repair mutations will respond to this combination. So I think, again, this is an exciting finding that needs to be further confirmed. Finally, there is toxicity with the combination. There were 4 toxic deaths when olaparib is combined with abiraterone. These were predominantly cardiovascular. There was only 1 in the control arm, so we have to be careful as far as our patient selection is concerned. If somebody's at cardiac risk, this may not be the appropriate treatment. Thank you and for your attention, and have a good day.